Senator Alsobrooks begins by confronting the secretary with a critical observation. He has repeatedly been unable to answer questions about his own agency. That's not a small detail. Cabinet-level officials are responsible for programs that impact millions of Americans, from newborn health to maternal care. And when they cannot speak knowledgeably about these programs, it raises a serious question. Are they prepared to lead?
Mr. Secretary, I'm over here. I've been sitting through this hearing all day today and have noted that you've been unable, in most instances, to answer any specific questions relating to your agency.
Because I haven't been given time.
Well, no, you have been given time, but the point of the matter is you've been unable to answer specific questions. Sir, you are the wrong person for this job, and you had in this hearing today the unmitigated gall to say at the beginning of your testimony that China is ahead of the United States in healthcare because China does not have DEI.
I didn't say that.
Well, we can roll back the tape. You absolutely
And
did
you
say
will
that.
find I didn't say that.
That is absolutely what you said.
I was talking about science, and I didn't say they're ahead of us. They're ahead of us in some forms of science, certainly not in healthcare.
Well, we can roll back the tape, but nonetheless, let me go on with my questions and ask you this. You just heard about the Safe to Sleep campaign, and you have made cuts. You made it very clear here today. You have no knowledge whatsoever of the absolutely amazing scientists and researchers who you have callously fired. You know nothing about the cuts.
Didn't fire any working scientists, Senator.
That, sir, is not true either. But nonetheless,
But it is true.
It is not true. Let me ask you
It is
another
true.
specific question. The Safe to Sleep campaign. Well, then can you name, sir, which office the Safe to Sleep campaign operates out of?
The which campaign?
Well, that's the one that the senator just asked you about 2 minutes ago that prevents babies from dying in their sleep. A 30-year program inside your agency. You would agree that it's
I
important.
think it's part of HRSA. Or ACF, it's ACF.
No, actually, it's in Health and Human Services.
Yeah.
And I think, and again,
No, they're all within Health and Human Services, but the subdivision is ACF.
no, actually, the name of the office.
Administration of Children and Families.
No, let me tell you what it is. The National Institute of Child Health and Human Development. This is actually the one that your aunt, Eunice Kennedy Shriver, is the person who it's named after. And you noted just a moment ago, the senator reminded you that although this is a very important agency, prevents babies from dying, this is the same one you fired every single person in this office as of April the 1st. It is also—
As I said, there were no working scientists fired during the RIF.
We can bring you that information later, but because what you just said is not true. Well, then the question also is, in addition to firing the individuals who make sure babies don't die in their sleep, why did you cut funding and staff from the CDC's National Center on Birth Defects and Developmental Disabilities, which supports the Special Olympics? Was that a mistake? I've heard you say you've made some mistakes today. Was that also a mistake?
We switched those programs to the Administration for Healthy America. They have not been cut.
Well, the funding has been cut, and this is one that oversaw the Special Olympics. Are you aware of that?
We have not cut the Special Olympics.
You've cut the funding, and you also dismantled the Division of Reproductive Health and Women's Health and Fertility. You're aware of that, right?
We have, right now, we have 42 divisions that do maternal health, and we're consolidating them. And the mainstream media has portrayed those as cuts, but they're not cuts, they're consolidations. It's ridiculous to have 42 divisions that are all supposed to be doing the same thing with their own administrators.
Well, let me ask you a question. So it doesn't exist right now. It's been dismantled. That is a fact, that particular division. What you plan to do in the—
There's 42 divisions on maternal health. We consolidated.
Sir, let me finish what I'm saying here. The fact of the matter is you have dismantled it as we speak. And are you aware, what does the assisted reproductive technology mean to you? Are you familiar with that?
Are you talking about IVF?
Well, it's assisted reproductive technology. It's a division. Do you know what it does?
Is it part of NIH?
No, it's actually a part of your agency. It's a
Oh,
part.
NIH is part of my agency, Senator. You should know that.
I do know that, but it's actually a part of, it's the CDC is where it is.
Okay, then it's CDC.
Right, okay. Let me just ask you, and again, these are all of the things you seem unfamiliar with, the programs that you've cut.
You're unfamiliar with my agency, that NIH and CDC are part of HHS.
Oh, I absolutely know. NIH is in my county. I was there this past weekend with the
I know that.
researchers that you have fired. So I absolutely know where NIH is, sir, and don't need any help from you in knowing that. exceed the time. Thank you.
The exchange quickly escalates into a confrontation because the secretary's testimony veers into inaccuracies or evasions. For example, Alsobrooks challenges him on the Safe to Sleep campaign, a decades-long initiative that prevents infant deaths during sleep. She notes that scientists in this office have been let go and funding altered. The secretary initially struggles to identify the correct agency responsible, misnaming divisions and offering contradictory explanations. For a viewer unfamiliar with how federal agencies operate, this might seem like minutia, but it's critical. Oversight hearings are where elected officials verify that policies are being implemented effectively and safely. Babies' lives are literally at stake here, so every misstatement carries weight. Another key moment is the discussion about consolidating divisions within the Department of Health and Human Services. The secretary frames this as efficiency, but Alsobrooks presses on whether these consolidations actually function as cuts, reducing the specialized attention that programs like maternal health, reproductive technology, and the Special Olympics support require. The difference between a cut and a consolidation might seem semantic, but in practice it affects how programs operate and whether vulnerable populations receive the support they need. For viewers, this illustrates an important lesson. Government reorganization is not just about bureaucracy, it's about real-world impact. What makes this exchange particularly educational is how it demonstrates the interplay between institutional knowledge and leadership accountability. A department head must understand both the structure of their organization and the substance of the work being done. If a leader cannot accurately describe the divisions, funding streams, or scientific work under their supervision, it signals a disconnect that could compromise program effectiveness and public trust. Finally, there's a deeper lesson in the persistence and methodical approach of Senator Alsobrooks. She repeatedly names the program, cites the divisions, and presses for clarity despite incomplete or evasive answers. This is a textbook example of congressional oversight in action, not a spectacle, but a disciplined pursuit of information to hold officials accountable. And for viewers, it's a reminder that oversight isn't about drama, it's about ensuring that agencies deliver on their mandates. So, what can the public take away from moments like this? First, the importance of knowing who leads the agencies responsible for critical services, health, safety, and welfare. Second, understanding that decisions at the top ripple down to programs that touch millions of lives. And third, recognizing that accountability isn't passive. It requires informed questioning, persistent follow-up, and careful attention to the facts. For anyone watching, the broader lesson is this. Hearings are not just political theater. They are opportunities to scrutinize leadership, understand policy impacts, and evaluate whether the people in charge are capable of fulfilling their responsibilities. By paying attention to both the substance of the questions and the accuracy of the responses, viewers can better grasp the stakes behind the headlines. If you want to stay informed, follow these hearings in full, read the transcripts, and learn how programs like the Safe to Sleep campaign, reproductive technology divisions, and maternal health initiatives operate. The more you understand the details, the better equipped you are to hold leaders accountable and appreciate the real impact of governance on everyday lives. For viewers, this illustrates an important lesson. Hearings are not just political theater. They are opportunities to scrutinize leadership, understand policy impacts, and evaluate whether the people in charge are capable of fulfilling their responsibilities. By paying attention to both the substance of the questions and the accuracy of the responses, viewers can better grasp the stakes behind the headlines. If you want to stay informed, follow these hearings in full, read the transcripts, and learn how programs like the Safe to Sleep campaign, reproductive technology divisions, and maternal health initiatives operate. The more you understand the details, the better equipped you are to hold leaders accountable and appreciate the real impact of governance on everyday lives.